Tell me your story.
I was this close to dying from a brain abscess that was misdiagnosed.
Good to know people care, though.
For a lot of people, the MRIs are clear.
You said you had a lot to tell.
Oh, yeah.
Someone said,
I thought it was normal to have like seizures by yourself all the time.
You definitely will feel guilt a lot.
I so appreciate you putting this together.
thank you.
Am I irresponsible for buying myself an expensive item? New to all of this is I got newly got diagnosed at the ripe age of 22 while being abroad and getting a grand mal seizure. I am still navigating the meds and lifestyle changes. Little background story, I have just had one of the worst weeks of my life. During this past week, I had a relapse. Two grand mal seizures after each other, a cluster, a hospital stay, increased dose on both my meds, and 2 days later, my mom got operated on for breast cancer. Then I had to go back to the hospital for a follow-up. Came home after a hell of a day to discover one of my favorite artist merch had gone on sale. This being the cardigan from TS and a bunch of other letters. It made feel good despite my kept rage that I have to endure. It's quite expensive as you would imagine, and now I feel incredibly guilty for spending that much money, although after typing this, I hear how it sounds. That's your budget. At the ripe age of 22, if you made the choice, yeah, it might come back and bite you in the ass, but you already know that if you don't have it. So don't feel guilty if you're not putting yourself in a worse position for more stress. What do you guys think?
I think you hit it right on the head. It's first of all, it's a lot to deal with when you're first diagnosed or have your first seizures.
Particularly when you're
And
just starting to enter life.
yeah, and I think it's kind of a natural reaction to buy yourself something to make you feel better. I don't really think there's anything wrong with that. The only thing I would say is get the hell off the camper if you're already feeling the rage and switch to something else.
Fix the real issue.
Yeah, I'm gonna sound like I know what I'm talking about.
Hey, accepting and addressing the truth is definitely a way to handle it. What do you think, Pookie?
I think I need a second.
All right, no trouble. Just think about if you would ever say no to a shopping spree.
Oh.
I kind of had a shopping spree yesterday. If you count socks, beanies, and a couple scarves and maybe one squishmallow for me. The one squishmallow was like the only thing that I would say wasn't needed, but yeah, I kind of blew through that child support check.
But hey, as long as it
No.
is for the right purpose. We've got
Yeah.
comments on this one saying, no, not at all. I mean, you know your fiscal situation better than anyone here does, but I hope it doesn't sound, or no, they're saying, but it doesn't sound irresponsible at all. Getting diagnosed is difficult and incredibly important to take care of yourself physically and mentally. If getting some merch will make you feel better after an undeniably difficult week, then do it. Also, you bought it on sale. Sounds like a responsible decision to me.
I could use that rationale to justify my rent.
Oh, that's the best. As long as it's on sale.
I didn't get top shelf this week, or was it sale? But it works just as well.
I mean, seriously.
Okay, maybe not just as well, but
My being here is a shopping spree, and I could say, well, like the rent is lower than the what it's worth. So what the hell?
I have a quote. Yes, it's a Jimmy Buffett quote. Spend it while you can't take it when you go.
Yep.
Yeah, spend it while you're here. Can't take it with you. Heard that. Focal. I'm diagnosed with epilepsy and I had a 5-day EEG last year, but they're not sure what type of seizures I have since they just caught a lot of background activity. However, my neuro thinks I could have generalized and focals. I'm just curious if what I experienced yesterday sounds like a focal. I had a point where I had a really intense deja vu, experienced it before, but it was like, in quote, oh, that feels familiar. And then I go on about my day, but this time it felt so much more intense and it lasted longer. And during it, I all of a sudden felt hot. I didn't think much of it until I noticed. I didn't think much of it until I noticed that today. I just felt off and I had lingering headache, nausea, and dizziness, which usually happens if I have a nocturnal. It's saying it's at a focal because
Sounds like
the
one.
I mean, the deja vu is there, the disconnect, but if this is the first one, did they mention anything about maybe having this or having recorded this before? I didn't catch that.
but they just said they caught a lot of background activity.
Okay,
So
so I
yeah,
mean, with the EG coming, test your know your triggers and get ready to make them happen.
record everything. Because some things you didn't know before, you'll start noticing when it's down on the page. Because you won't remember next time. And you won't remember the time after that. But the page is eternal. Mostly, unless you toss it into a fire. But you know what I mean.
I know what you mean.
Have you ever had an impulsive shopping spree after a seizure? I know I have bought things that I did not know about. Got deliveries and it was chalked up to you bought this when you were definitely post-ictal and here it is.
Not that I remember.
Done some Amazon shopping at post-ictal.
Yes, that's exactly who pulled up the next day and I didn't know why.
Yeah, been there. But I kept this stuff. I forgot what it was. It's the worst. Ordering stuff you don't need.
I actually have an icebreaker.
Go
Let's
ahead.
hear it.
That's, if you could choose any person from history to be your imaginary friend, who would you choose?
Can I choose two?
Say that again.
Can I choose two?
If you could choose anyone from history, anyone that's ever lived to be your imaginary friend, who would you choose?
Tom Brady.
Tom Brady. There we go. He's the footballer, right?
Yes.
Okay, good. I remembered.
English football.
Yes, American football.
You
American.
gotta specify.
I got nothing.
I'm doing some research.
Can I choose two?
Yes.
Yes,
Sure,
please.
why not?
Jerry Garcia and David Crosby.
Ooh.
My two favorite dead people. My two favorite
Two
people.
dead people.
Got a post here. It says, anyone feel this way? Days like today, it just feels like I'm right on the edge of having a seizure, and it makes me just want to lay down all day. It feels like I was active and I just got a heart rate up, or it was overstimulated, so it would trigger a seizure. It's hard to explain, but I have these days where I just feel like I'm right on edge and it's just uncomfortable and it makes it hard to function and be productive. Feels like my nervous system is on edge. The question was, does anyone feel like this?
On edge? A lot.
Kind of every day. I don't know if I feel, well, I do feel on edge a lot, but I don't feel like I'm going to have a seizure. I just feel a weird feeling. I feel weird just watching myself every day. You know what I mean?
I've
Well, you do a
noticed,
lot of editing.
I know, but beyond that,
I've noticed that I can get like, I'll start getting like anxious in the days leading up to before I have a tonic.
And that's what took so long to actually start recording because those are the days that I did not want to acknowledge, just wanted to make it through and get it over with. But it made a difference.
Crackers.
Yeah.
That's why I track stuff like that.
one of the comments here says, I've been living on edge of nothing for weeks now, and I'm just trying to remember my name, let alone what I did 5 seconds after trying to forget I'm a dead woman not walking.
A couple days ago, I missed my happy. Where did my happy go? No matter how long or hard I look, it's just gone. I'm beginning to think that happiness resides in the epidermis. Each seizure I have is just scraping off a little more happy, a chunk at a time. I don't know why I'm complaining. It's been this way for a very long time. I'll get over it sooner rather than later. Much love to all my sad homies. So I wouldn't, if you can make jokes in the post when you're complaining about how your happiness is gone, then just put
You're
that
not
energy
unhappy.
into, yeah, if you put whatever energy you have into, getting back on track with that happy. And this is somebody who maybe like remember doing things for other people can be a better way to, get out of your own
Sometimes intrusive
boo-hoo kind of
thoughts
time.
will get to you, though.
Say that one more time.
Sometimes intrusive thoughts will get to you.
Oh, yeah.
It does get rough when you're too critical of yourself for sure.
But I think that they are going in what you said, they're going in the right direction. They're making jokes. They're going to find new humor and new ways to smile.
All right, the comments are, you're definitely not alone. I've been thinking about this a lot lately. Seems like I'm losing a piece of myself, mainly my happiness, every seizure I have. Recently had one and just feel trapped in my head, but trying to keep it together for my family and hope you all feel the best.
I
Or
want to
hope you all
plug
the
in
best.
something.
Yeah, that's a good way of looking at it. What do you think, Toaster?
Not toast. Therapy. They both begin with a T. Therapy. CBT therapy is like the best at finding happy. I think everyone should have therapy.
I think I need therapy.
Another one of
it's
these
been hard.
comments too is saying, I'm with you. A lot of happiness has been turned into pain and anger. I'm slowly getting it back. CBT and forcing myself into hobbies that are doable has been a life changer. Easier said than done. Talked about it for months before. I hope things get better for you. You guys ever reflect on how long you're planning and brainstorming something before you actually went for it and everything got better? Like, why didn't I do that so much sooner kind of thing? Yes, absolutely. Has
All
that
the
happened for
time.
you guys? You think more this year or within the last couple months?
The last
I'm
year and
trying
a half.
to I'm trying to link like everything to lunar cycles now. I seriously believe in this.
Oh,
Mine is since about 2020. I've always been a procrastinator, but it's gotten way worse since
I
I've been home.
chalk it up to ADHD. The procrastination's kind of the thing, and also the hopping from everything so nothing gets done.
Yeah, I have that problem too. And then there's I can just lay down next to a pile of work and take a nap.
Yes. This chair looks very nice.
It's too
That pile
easy
of
for me.
laundry that needs folded looks very nice and comfortable.
It's warm. It's just from the dryer.
Right. It'll feel really good on my sore neck.
Exactly.
I got one here. It says, do myoclonics worsen with age? I started having what my doctor thinks could be myoclonic seizures when I was a kid. The earliest I can remember was second grade. It began as a feeling of, in quote, something being off, something missing. A sort of deja vu and a strange, airy, yet electric feeling moving up from my stomach towards my feet. Hold on, moving up from my stomach towards my chest. And in addition to feeling generally space, it came and went as I aged and worsened. But as in, I started getting twitches alongside the feeling in middle school where they were quick chills. In high school, they were longer with a little shock. And as I entered adulthood, when it happened, my right arm and my right side of my body would suddenly jerk out of control. Now, at one tail end of my 20s, they happen 10 times more. Sometimes, sometimes the in quote shock effects took my whole body. I drop things and make involuntary noise like a vocal reaction to a sudden shock. I can always feel them coming on, but it is normal. It is normal for this, isn't it? Normal for this to get worse. Alongside a having migraines for the first time in my life, and sometimes the strange feeling that comes along before the jerking stretches out for hours, and I jerk I jerk for hours and the jerk never what? I jerk for hours and then the jerk never stops. And then it's 3 to 5 times within the hour. I have other weird and unpleasant symptoms, but I don't want to make this a long read. I'm on lamotrigine for bipolar, and symptoms do worsen if I miss a dose, but never fully subside. Is it because I'm becoming unpleasant? Do the myoclonics worsen with age? Was the question. I
Yes,
don't. They
can.
do.
It
Yeah.
It
sounds
sounds
like
like his seizures are just getting progressively bigger. Like mine started out with focals and then progressed into tonic-clonics.
mine have progressed some too.
At least we're pretty sure it started with focals because I was misdiagnosed for years.
Yeah, my clonics. I just thought for some reason I just thought I was just having random nerve twitches. That's what I thought it was. Didn't think anything of it. Um, yeah, I didn't take mine to
Have
be anything until someone on Reddit told me that's myoclonic. I was like, oh, well, now I can tell my doctor that this has been happening for this long. And
Kate says that we've heard of plenty evidence of medication not working long term either. So if you're continuing the same medicine, that might also the medicine's effectiveness might just be going away. I hope that never happens with me and Excopri.
some of the comments here. One says, mine have done the opposite. I used to have over 100 a day as I walked to and from school, but it is a good chunk less now. What has changed in the different ways they trigger? Used to be sunlight, now it's all sorts. Another comment here says, mine started around 13 to 14, then progressively got worse until I had my first TC at 16. They can definitely worsen if untreated, but if you've been having them for years and they're getting more intense, definitely go get that checked up on ASAP. One more. It says mine started at 19, but I did have a small episode when I was younger. I was also all right during my 20s, having 2 to 3 TCs a year, having 3 to 5 TCs a year. Right after I turned 30, they started getting worse, and I found a great neurologist, epileptologist in my area. It's starting to get more under control now, but I'm not stressed out as I was then. How bad are your myoclonics, Andrea?
I haven't even been diagnosed with myoclonics. I just suspect that I do because I have weird twitches, but I haven't really even talked to them about it.
Yeah.
So I don't know.
Yeah,
Mine
just,
Yeah.
are very small.
do you want to hear the epic going on with my sleep medication, my Ambien?
Go ahead.
Okay, so my neurologist took up my Ambien when I fled the coast last year. And she's been prescribing it for about a year now, and she sent a message saying, ask your um ask your primary to take up this medication. It's not really one that's in my purview. Okay, ask the primary. My primary says no. I'm going to refer you to a sleep specialist. It's like, oh, wonderful. Go back to my neurologist and like, hey, this is what's happening. Get a response back saying, yeah, by the way, did you realize you missed your appointment last week? I had an appointment last week. Even my mom was like, oh my God.
What happened to call for confirmation and things like
I
that?
know, usually Duke is like calling and telling me every day.
For a month.
Yeah, it didn't happen. So I don't know how, but we have another one scheduled. I have a virtual one in 2 weeks. Uh, she wants to see me in person, but her earliest in-person appointment is in May.
But you get put on
Yeah.
the list of call for
Oh yeah,
cancel.
yeah.
I
Um,
just got on that list and I just got a call. I think
but
I got one for next month
that's
instead
why
of it being in March.
I have I have a concoction of medications that I can manage life with pretty much, I think. I just want to, if I could just get someone to just take my word that I do not sleep. But no, I'm going to have to do a mini EMU.
The sleep study?
Yeah, the sleep study.
I had one.
Just to prove that I don't sleep. But the worst part, I think, is they're in a sleep study. They will not let you have books, cell phones, anything to
Is it one
keep
of those
you off.
ambulatory ones that you're gonna wear around, or you go
No,
there?
I'm going
Oh,
to have to go there. I haven't actually even met with a specialist yet. I just know this is going to happen because this is what always happens. And those nights are the worst because all I can do is lay there and stare, and they're just so long. And I can't
At
stop
least they know
moving.
you can't sleep.
Yeah, I know. But the last one I had was actually up in Raleigh, and I swear I had one of the rudest nurse. They took it as an affront that I wasn't sleeping because it's like it's, it didn't have my medicines.
we have another one here saying legs not working for hours. I woke up fast and suddenly couldn't walk or talk and fell to the ground. I gained my speech back somewhat, but still couldn't hold myself up or lift my legs while lying down for about 7 hours. Anyone else experience something like this? I only experienced focals, but this is totally different than I remember ever experiencing. You wake up fast and couldn't walk or talk and fell to the ground. Okay, so you woke up fast, and if you fell that fast, then maybe you were stood up. Couldn't walk or
Yeah,
talk and fell to the ground. That's like one of those seizures that you have on the way out, like on the way when you're waking up.
but they do have drop seizures. I don't think I had enough information to specifically say it was a drop seizure or not, because the person are just saying they just got up. Um,
Well,
yeah,
after that, they make the point that I gained my speech back somewhat, but still couldn't hold myself up or lift my legs for 7 hours. 7 hours of not being able to move limbs definitely exceeds anything I've ever had in a seizure or ever heard of anyone having in a seizure. That's one I would have probably recommended a 911 on.
yeah. 34 and pregnant and experienced my second TC seizure. I'm 34. I'm 17 weeks pregnant. I just experienced my second tonic-clonic seizure in 2 weeks. 2 weeks ago, I crashed my car. Luckily, I was in a parking lot, so it wasn't anything big, and there was no clear witnesses, so we were not sure if it was a seizure. This one was in yoga class right at the end, and a doctor was in the class that could confirm it. So at the hospital, I started Keppra. I was originally hesitant because I thought my first episode was when I was heart related, and I also did not want to harm my body. I've also always been prone to PMS, migraines, and thought it could be hormonal. But after today, seeing my blood vessels popped around my eyes, bruised on my face, and bitten tongue, I can no longer be in denial and took a loading dose of Keppra. Anyone in a similar boat? Any advice? It's such a new scary diagnosis. I can't be pregnant, so I can't be a part of that conversation.
Both pregnancies, my seizures went down, but if that happens, why can't they have a spike? Hormones are weird.
Yeah, I'll just say that
Absolutely.
sucked.
My heart goes out to you. I hope your pregnancy ends well.
Try to find a doctor that specializes in something that handles that kind of thing.
Bright side is you get monthly pictures. Forgot what that's called.
Sonogram.
That thing.
That thing. Yeah, I didn't know what the name of it was, but there you go, monthly sonogram. Um, I'm assuming that's a good thing. To be honest, I don't know.
Yeah, so they check on fetal distress and formation.
High risk pregnancies get it more, right?
Yep. And
I
having
remember going to the
seizures
doctor.
would bump you up to high risk.
Sorry to hear that, ladies.
I thought it was kind of hilarious how nobody ever said anything about a natural birth to me. It was always just like first trimester, okay, let's schedule your C-section.
I
Did
ended up
both of
having
you
a
have
C.
did both of you have C-sections?
Uh, Jeffrey, it was an emergency C-section. And the other one was going to be.
Mine were two
Both
10-month C-sections.
Oh, wow, 10 months?
Yes.
big babies?
6 and 7. He was six
That's
point
not
something.
that
She was
big.
7 point something. No,
Jeffrey was
not bad at all.
small.
Both of mine were one was 6.9, the other was 6.10.
Jeffrey was
And
6.9
you can remember those numbers. That's cool.
or 6 point something.
6.9.9 and 6.10.4.
Can remember it to the hundredth, to like the thousandth. What?
Yeah,
I
That's
don't remember
amazing.
what time they were born, but
Oh, whatever.
my mom remembers what time I was born. She
I
calls me.
remember
She
the
called
date.
me. She called me at 6 a.m. and I was
Aw.
asleep. And at
That's
that time,
adorable.
it was so late. I mean, so early that I didn't even know what day it was. I was just like, "All right, mom." She just as soon as I picked up, she's singing "Happy Birthday" at 6
Oh,
a.m. So yeah, that's what happened. It was hilarious.
And some parents
I,
even remember the day of the week it was.
I
Yeah.
was born on a Monday. I think my daughter was born at like 9:30 something and my son about 11 something, but I'm not positive.
I was born on a Tuesday. Tuesdays. I hate Tuesdays. They're the worst day of the week.
Why?
Because they're still at the beginning of the week, but they're not Mondays where you have all that energy at the beginning of the week. I can do this. It's
That's
not
how you feel on a
Wednesday.
Monday?
Oh, it's not a Wednesday where it's like, okay, I can get over the hump. Thursday is tomorrow's Friday. Friday is Friday. Now I love Tuesdays though.
Friday is Friday.
Yeah.
I was born
You-
on the 35th week of the year on a Thursday.
Nice.
Uh,
He is 9 days younger than me.
so you were born uh, on a Tuesday.
Yes.
Okay. Wow.
That's why you're my little brother.
So I got a comment here. It says, "Talk to your OB."
OBGYN.
Oh, I was gonna say Obgyn. Okay. Yeah. OBGYN. Okay, I was trying to figure out how to pronounce it. And I was gonna say Obgyn.
It's an acronym.
Yeah, I see now.
But now that's a short.
Yeah. So talk to your OBGYN ASAP. This very well may be a hormonal issue. Also, they need to know about this and as soon as possible. Another comment here says, I did have my first TC when I was 14-ish weeks pregnant. I did ended up having three my whole pregnancy. I was put on the Lamictal and I only had three, after the pregnancy. But after the pregnancy, I had one. Everybody thought it was a hormone thing, but I have since been diagnosed with treatment resistant epilepsy, and I'm in the process of planning surgery. Though I will add, it turns out my in quote panic attacks for the last 12 plus years have been focals.
I said, welcome to the club. Happened to me too.
So that post about the one that was weak or numb for 7 hours, one of the comments is Todd's paralysis. And that's that thing they describe as a temporary post-seizure neurological condition characterized by weakness or paralysis that most often affects one side of the body. But get this, it also involves slurred speech or vision problems. So that's another, post-ictal, not common thing, but that's a post-ictal thing. Paralysis typically resolves on its own within 30 minutes or 36 hours. And it
Quite a
mimics a
range.
stroke. Yeah, mimics a stroke, considered benign, and a phenomenon that doesn't require specific treatment beyond rest and managing your seizures. Wow. How would they treat that? You treat it like you would have to treat it like a stroke, but then just come to the conclusion that you're all better on your own. So it must be the paralysis. I'd never heard of this in epilepsy.
I gotta get my paralysis checked on.
How's yours doing?
Um, I need a new neurologist to check on it. I don't want to take things into my own hands ahead of time because I don't quite understand it. Um, yeah.
I mean, since this might not be, and I mean, what if they prescribe like physical therapy or something? Couldn't that be a PCP thing?
Mm.
Especially if it's like linked to the stroke?
So the thing about physical therapy, if it's not indoor at the hospital, then it might not work for me, being the distance between me and the hospital now. I'm not near my hospital. So, yeah, not being near the hospital is difficult because they might have programs for people who are in that area or something like that. You never know. Um, yeah, you never know with that. Because last time they tried to prescribe me for not prescribe me, give me a physical therapist for the after stroke care, and had to tell them that I'm not going to be in the area. So you guys are trying to refer me to only do this county, and did
I'm not
not.
there.
So I didn't get after stroke. I mean, after care, post stroke. Um, Everything I found on YouTube.
Yeah,
Um,
so now you're totally prepared to, for that next appointment. Whether they ask you the questions or not, this next one has to at least be able to, even if you don't vibe with them, they could give you the referrals that you need. You could still, I keep wanting to say like cash in the referrals, but you use that, at least get what you need, pharmacy to hold the prescription and or try the new medication, whatever you want. Get like a really strict plan on one of those new meds that you can, not new medication, but like a new medicine for you that you can try really gradually. And once they have that strict plan, that's what made me feel like I was finally making progress, is when they said for the next 2 weeks you take this, another prescription, or just like stop breaking it in half or something. They came up with like a really detailed plan of what to do, and then I didn't feel so, I don't know, kind of like having to do it on my own.
okay. Um, I do got something here. It says boyfriend trying to get his license. Hi, I'm not very familiar with posting on this Reddit or with this sub, so I don't know if this is the best place to ask, but my boyfriend is 22 and was diagnosed with epilepsy at 16. Due to his epilepsy and other circumstances, he hasn't been able to practice driving or apply for a permit until recently, as he is now 1 year seizure free. My question is, how exactly do you go about getting a permit or a license with epilepsy? I've tried looking online and found forums mention and Epilepsy Foundation mentions needing a hearing, but most information seems to be about drivers already with their license. I just can't seem to find any other clear answers for his situation, and I don't want him to go to the DMV and not have everything ready. We live in upstate New York, and any experience or advice with this would be super appreciated. Thank you. It depends on how far you live from the hospital. I mean, the DMV hospital. I used to live close to a DMV and go there for anything. Yeah,
Sounds like this one needs to get a medical professional involved. At least get like a doctor maybe to tell you that DMV driver's license, like that's just not the right route to go.
Yeah, the it sounds to me like his doctor's telling him it's okay though, because I mean I don't agree with it, and I don't think anybody should be driving if they're having seizures or have been diagnosed, but it seems like a lot of people are going to do it, but they're going to have to go through their neurologist for paperwork. I know that. And I would start there. Maybe they can answer any further questions. But I say don't drive. It's not safe. You never know when you're going to have another seizure, and your seizures can change at any moment in time.
right. Imagine, since I have wandering off seizures, imagine if I just drove off somewhere. That would be insane.
That
I
can
mean,
happen. That can
um,
easily happen.
Imagine if I was driving through the Kirby Mountain roads that were going like this through the hills and all of that, and I just went into the absence seizure that unconscious, and I totally don't remember it for about 15 minutes. And my son told me about it later. Like
so you're speaking
Yeah,
on
he's,
something that
just
happened
while you're
already,
driving,
right?
especially on those roads, those like really thin
I
roads.
wasn't
So,
driving, I was in the
oh, okay.
passenger seat,
Lucky.
but
Oh,
like crazy. He had to pull over in like some crazy spot, and he's like, "Yeah, a lot of people were really pissed off where I stopped, but you were tending to you having a seizure in the seat next to me was way more important to, I was off the road." So,
yeah, those are
but
the ones that I
yeah,
definitely feel bad for.
right. It's just like there's times like that. It's like, oh my God, if I would have been driving, how many people would I have hurt? Or, what would I have done? That's terrifying. Driving down the highway in a big SUV in, 70 miles an hour on the interstate during rush hour in a, you know, 4,000 pound SUV. It's just people do it all the time. It's crazy.
One of the comments here,
Sorry,
it
I
says,
ranted.
huh?
I said, sorry, I ranted.
That's what
No.
we all love.
Yeah, you learn something every time someone says something. I like
I'll
your
be here for a
hair.
little while.
I like the
I didn't
pigtails
see.
too.
It's not pigtails.
No, I'm
It's
saying I like the
braids.
pigtails too from earlier. Oh no, you said those are braids?
Yeah, I just braid it. I just like split it on each side and I braid this side and I braid that side. That's it. That's
Oh,
why it's
wow.
all pretty and that's why it's all pretty and wavy
How long you
because
been
I had
growing
it.
your hair?
I stopped going and getting it cut regularly in 2020
Oh wow.
and it was probably about this long then. And now, well, I didn't go at all, I don't think I cut it at all for 2 or 3 years. And then now I'm at the point where I pretty much just go schedule a trim every about 6 months. But she cuts off like, a good chunk of it to get it healthy again when I go in. So
Do you even
I'm
bother
just cheap.
looking through the styling books to decide if you want some kind of like pattern cut in the back
No,
or always just a
she,
totally straight cut?
yeah, she has cut my hair for forever and she knows I'm going to wash it and I'm going to let it dry. I don't style it. I don't.
No framing the
No,
face or layers.
I did that when I worked a job and I had to. You want to know the one and only styling tool in my house?
Straightener? Blow dry? Oh, okay. Good old wide tooth comb. Can't go wrong.
I got one sitting right here next to me. I got one in my bathroom and I got one in my shower.
Got a comb for every room and every place.
Do
I
you have
don't
that many rescue meds spread out?
I don't have rescue meds.
Me either. I need to do that. I need to get that. Yeah, that's something I need to write down to get to my mother.
I just go unconscious. I've only had seizures with other people on 2 occasions.
Lucky you.
But if you're
No, I'm always by myself.
clear, well, if you're clearing
Uh,
up in between clusters, like during a cluster, I theorized in one of my notes that I could have gave myself the nasalium on this one, but the family that was around said that I was so positive that I didn't have a seizure just now.
I argue with everybody that I didn't
Exactly.
have a seizure. I didn't have a seizure. What are you talking about? They're like, yeah, you did. You just had a seizure. No, I didn't. I'm fine.
Unless the incontinence happens, then I'm saying no.
yeah.
I can't wait till I have one around my mom because her and I don't get along as it is. If I do that with her, it might get ugly.
I think I had a seizure this morning. I'm not sure. There was a lot of confusion.
Did you rest afterwards, at least before you got on here?
No, it was. It felt like in the beginning. In the beginning, I felt really confused, and I was just yeah, it was a little bit of everywhere in the beginning, and that's where I feel like I might have had something. You never know. Um, but I'm all right. It didn't graduate into a TC, luckily.
That's good. That's good.
Yeah, and you
Yeah.
got a time for it.
Say that again.
Sounds, I was saying it sounds like you're getting details for it too, like there was an approximate time and the length. It sounds like you said you know it wasn't like a long one or it definitely didn't get to a TC, so being able to tell kind of what happened from how you feel after is really good.
Yeah, it was just like in the beginning, like you guys noticed, like I was really like reading slow and just all over the place. Now I feel back to normal. What is normal these days?
You're normal. That's what we can go by. Somebody
I'm
else
sorry.
has having a problem here. They're saying epileptic. Does anyone have a problem with this term? I'm not keen on being called an epileptic person, but referred to as an epileptic is something I really don't like. It's like that's what I am or something, like it defines me. I would tell this patient, don't take it so personal. I don't know. Have you guys ever taken offense to that?
No,
I
but
don't.
and I don't take things like that offensively, but also I've dealt with people who took a lot of offense to the word epileptic, and yeah, I met someone on Reddit who didn't want to be friends with me anymore because I allowed someone to say epileptic in a comment and I didn't comment back, and yeah, this person was really disappointed. Yeah, Andrew, you're looking like what? Yeah,
Yeah,
it was that difficult.
somebody quit being your friend because somebody else said that to you.
Yes, because I didn't comment back and let them know that it's not nice to say that. I should tell them. They should say person with epilepsy. That's what she said, and she's like, I don't want to be your friend anymore.
People will reveal their true colors.
Yeah, that's a
And
very nice way to put what I had in my brain.
one of the comments with a lot of likes here is don't let it define you. But you are an epileptic, right? I am, so I don't mind when I'm called an epileptic. Just make sure to tell people how I get through life with epilepsy. Most people will look at you with strength, not weakness, if you present yourself well. It sucks being disabled, but don't let it define you.
I think the same
I'm a
is it's
teacher.
very similar with like the word disabled. A lot of people find being called disabled or, saying that they're disabled really bothers them, where other people, like, it doesn't bother them at all.
That's a
Yeah.
pretty easy tell of where they are on acceptance. Just
Well,
I've
overall
and
accepted.
confidence and self-appreciation or whatever you want to call it.
the stigma of the word as well is huge. But I don't know, I think there's kind of a lot of words like that across the board, and a lot of people have a lot of different feelings about them.
Personally, it doesn't bother me, and I told her that the person that decided they'll never come on the podcast again, and yeah,
Still hope you're doing well.
yeah. Hope you're doing well if you're watching. So Sorry to say. What would you do, Andrea? If a friend told you, I'm not going to be your friend.
I would probably tell them that it's none of their business how, like, I let people talk to me. I mean, I don't know. I can't put into words right now what I have in my head, I guess. It's like it's not their place to tell you what to say, especially if they don't have epilepsy. It's just that's out of place. It's out of line, and as far as I'm concerned.
Got one that says night sweat or nocturnal seizures. I wake up a lot of days soaked in sweat, but my head and my body aren't sore like a seizure. Is this my epilepsy or just me not controlling my body temperature? I have never been able to control my body temperature in particular.
Especially at night, harder then.
Yeah,
Try cooler blankets, you know, or pajamas or whatever, and see if it helps.
yeah, I just
Because it
try not
doesn't
to.
sound like a seizure. It doesn't sound like a seizure to me, but
Might be the medication
yeah.
because I get night sweats quite a bit, and I always blame it on the medication. Um, yeah, I sweat so
Yeah,
much. Not every day, but yeah, it's like a
I
bad
used
some
to.
days. It's like which is
Yeah,
fun on some days where I'm just waking up and now I just
in a
sleep so much
puddle.
better. Yeah,
Are you
it's
guys
much.
ever suspicious of drinking more leading to like if you drink more water, it's easier for you to sweat?
I don't think so. It just makes me have to get up and pee more often.
Some of the comments here on the nocturnal night sweats, or it says night sweats or nocturnal seizures. A few of the comments here. One says, just it's not every night. Another one says, if you want to be sure, you should install the app Prime Sleep Recorder. I've been using it for years just to keep track of my nocturnal seizures and on to decide what medication doses are the best. You can re-listen to every noise during the recording and maybe find a pattern and whether they're nocturnals or not.
What's
There
it
you
called?
go. Take your notes and look for the pattern. Prime, it sounded like.
Um, Prime Sleep app. I mean, Prime Sleep Recorder app. Let me know what it is. On to the next question. Question about anesthetic. Hey gang, I have a planned surgery for once. Ha ha ha. Every other surgeries I've had were emergent, but this time it's elective. Just getting a just getting a pesky organ I don't need I do not need removed. My question is, how did you find anesthetic reacted with your seizures, if any at all? I did want to flip out. I don't want to flip out if my seizures start stacking up on me after being fairly under control lately. About anesthetic. I've gotten put under um, recently, and it didn't bother me. Yeah. How does anesthetic bother you guys if you get put under? And
Doesn't bother me at all. I've had like 15 surgeries and I'm a professional. They love it when I go in.
Medications is one of the triggers for me, so every time I've been within like 3 or 4 hours after, like I guess when it's almost done, that's when I'll have a grand mal. It was better after the RNS, like it was shorter, not so severe. all 3 or 4 times it was in I know after the RNS surgeries I wasn't at the hospital, but after the pregnancies I was. So like half the times it was in medical care, and they all agreed that it was shorter, less severe, and because of that.
Hey,
I
Angel.
really like,
Oh, go ahead, Andrea.
I was just gonna say I really like that white stuff they give you right when they roll you, right before they roll you in to
Yeah, and
knock
then
you
they tell
out.
you, and they were telling me it's
Just,
gonna burn a little bit for a second, and then it'll go away. And then they were
just
like, "You're
count
gonna go."
backwards. I love it. Count backwards from 10 and you're like 10 and you're gone.
I think I just laughed, and they were like, "Are you all right?" And I was like, "Yeah, I'm all right." I was just like, "I know what's gonna happen," so I found it funny. They're just like, "Oh, okay." And yeah, I guess I didn't wind down as fast as everybody else because they asked me, "Am I all right?" a few times, and I was like, "Yeah, I'm good. I'm good. Yeah, I'm still
Sorry, I'll take
here."
a big deep breath.
Yeah, it's like I'm
You
still
weren't
here.
breathing
I'm
deep
still
enough.
awake. Angel, have you had any anesthetic? Have you had any procedures? Could you explain how it went?
I only had a biopsy. Sorry if it's loud.
It's not.
Yeah. Okay. Because I'm at a Burger King playground and the kids are being loud. Um, I had a biopsy for my liver and they gave me something then. I think the only other time they gave me something was when they gave me morphine to pop my shoulder back in when I dislocated it.
Yeah.
But yeah, I think the biopsy was the only thing close to a surgery that I can say that I can remember.
Okay. Yeah, this person is basically just looking ahead of time, I guess. Yeah, they're gonna get something planned and wanted to know whether to be worried or not and how. Yeah, you're not worried, right?
No, I don't think you should worry. I think, I mean, there's horror stories and everything, but then there's also good success stories too, you know. You don't know how anything's going to turn out. And worrying just pretty much lowers your threshold on seizures, if anything.
One of the comments here says propofol and most general anesthetics are very strong anticonvulsants. Your anesthesia provider, CAA or CRNA or anesthesiologist, is very knowledgeable about keeping you safe before, during, and after your procedure, just as long as they avoid flumazenol, flumazenol. Um, Kate, can you pronounce this for me? It's FLUMAZENIL.
How do they come up with this stuff?
It's a
Want to call it
benzodiazepine.
Romazicon?
Huh?
Brand name, the brand name is Romazicon or Anexate, but flumazenil, I guess is the
Flumazenil.
phonetic pronunciation. It's a benzo.
Yeah. It says it's a benzodiazepine reversal agent, which they will. You'll be fine. Uh, some of these medication names, like Andrea said, where do they get these from?
Apparently,
Let's
that's
just
something they give
jumble
you
up
if you
the
OD
alpha.
on a benzo.
They just throw them all in a sack and shake it up and grab some out and throw them on the. And let's put them in order. That's what we're gonna name this one.
Who put that in the bag in the sack? 'Cause
It's like Scrabble, but they just make it up as they go.
we're gonna give you 6 letters and make a medication name.
No, it's not 6. It's got to be like 15.
Mm.
You got to have like 5 syllables.
Yeah, it could be a lot of syllables, but I'm saying,
There's probably rolling the
oh,
dice in there somewhere for more
And it's
Add a
gotta
A E
end
syllable.
I O
with,
U A E I O U whatever I'm going for.
Vowel. Vowels.
and
Thank you.
it's gotta
Add
end
a
with the
vowel.
AM.
yeah.
Is it like Wheel of Fortune? You could buy a vowel.
Yeah, and like your currencies, how many seizures you have.
There are a couple more comments here. One says, I had my gallbladder removed last year, no side effects. Seizure wise, best due. But due to the time of my surgery, it was I was able to take all my medication at the usual times. Maybe worth mentioning this to your surgical team. I have no related problems related to my epilepsy during or after surgery. And everybody else here just says I had no problems, bunch of surgeries. Yeah.
I was never had any problems with my meds. I just was they always do the like pre-check-in stuff and go over everything and all of that ahead of time and talk to them and make sure you know, like, this is the meds I really have to take because it's my seizure meds. And they'll, they always let me take those at least even in the morning when I wasn't supposed to eat or drink anything because of anesthesia. They just told me, a little sip of water, not just a whole glass of water type thing.
I read something on a post that I put. I posted something that it said about like if you were to miss a dose, and it's like since I take my pills at 10 p.m. If I was to miss a dose and then I remembered at like 7 p.m. or 5 p.m., do you wait till the next dose or do you take that and then still take it at the 10? Um, Somebody just told me that my medication, if I do that and I double dose, it could mess me up. And I didn't know that because I've double dosed quite a bit. Some just in case doses when I can't remember. Then he specifically said my medication in particular could be really bad double dosing. You guys ever been told that?
I think with the clobazam, the controlled substance, I asked it of the pharmacist though, not the doctor.
Hmm.
Yeah, I talk to the pharmacist about my meds more than I do the doctors because I feel like they're a lot more educated than the doctors are. The doctors don't have a clue. They think they do, but the pharmacists are the ones that really know what's going on and they know all the rest of your meds too. So,
Yeah, I need to get my doctor on deck. Um, Got another post here. It says apparently I had a seizure. Um, I'm not sure how to make that a question, but there's question marks after that. It says apparently I had a seizure. Question mark. I'm not sure. Also another question. Bit of a rant as well as a question. Sorry. So yesterday I was doing something, not exactly sure what I was doing since I have a horrible memory, LOL, and my sisters freaked out because I had apparently started drooling and had that outer space look and ran to my mom screaming. End quote. I think she's having another focal. And they both shoved a pill in my mouth an hour before I take it. And the thing is, I felt fine. I mean, I really felt fine. I didn't lose consciousness. I was well aware of my surroundings. So, yeah, not sure when I'm actually having one because I space out a lot. Another thing is, so I have two molars I need to get rid of. I need anesthesia to get both of them out, and they don't want to send me into an attack by stressing me out when they do that. Currently taking two pain meds to help with my tooth pain, tramadol and penicillin. I just read a bit ago that tramadol reduces the effect of my epilepsy med will have on me. like unsure how to explain it. It makes it risky. But my doctor gave me the meds for pain, so I don't know if I can still take this or not.
My first comments is tramadol I wouldn't probably take because it's saying it lowers your seizure threshold. You need to talk to your doctors and have them prescribe you something different. And the other one is not a pain medication. It is an antibiotic to keep you from getting an infection or to fight an infection that you already have. So,
I like
in
that answer.
essence, you need to go back to your doctor and your pharmacist because if tramadol and your seizure meds do not get along, and it is very high likelihood that you could have more seizures because if you take the tramadol, it will lower your seizure threshold.
You give great advice because I just learned something.
For once in a moment, my brain worked and put it all together.
Perfect timing. Um, there is a comment here. One says, regarding the medication part, talk to your pharmacist about possible interactions with the two medications. My first neuro told me a certain med was fine to take with my anticonvulsant, but it actually wasn't. Never be afraid to ask for multiple opinions when it comes to your health and medication. Yeah, I'm never afraid to ask for second opinions. Sometimes I go best to three. Um, yeah, these days you can't just listen to one doctor.
Epilepsy Foundation saying acetaminophen, the Tylenols are the safest for epilepsy patients.
Wait, say that one more time.
The Epilepsy Foundation is recommending that acetaminophen, Tylenol is the safest medication for aches and pains.
Something tells me the Tylenol's not cutting it for this tooth, which is why they gave him the tramadol
Yeah,
or
because they're not
Toradol
supposed
or
to take
whatever it is.
hydrocodone.
Mm.
Yeah, I think they gave me Lortabs and or Percocets after my hysterectomy.
I
Yeah,
think
but
that's why they gave
specifically
me morphine.
tramadol, they're definitely saying should be avoided by patients with epilepsy or susceptible to seizures unless there are compelling circumstances. So
I've
unless you
wondered,
really need it.
I've always wondered if my long-term opiate use is part of the reason that I have seizures because after I quit taking all of the pills is when I started having the seizures.
Mm.
That can't be a coincidence.
Or it could be, that maybe all of the opiates that I was on was, just calming my brain enough that I wasn't having the seizures.
Possibly.
Who knows? I don't know. Weird.
All we can do is experiment on ourselves now.
Yeah. I don't take them now.
Poking
Like
pride at
unless
ourselves.
even when they cut out organs, I think I took two of my pain pills when I got home. Heating pad worked
Nice.
just fine. Just don't do much and use the heating pad. That was all right.
You're in Kansas, aren't you?
I am stuck in the middle of nowhere.
All right, so you can relate when I read this post. It says driving
Try.
in Kansas with epilepsy.
Driving in Kansas? Good luck.
It says I had my second seizure 5 months ago with a head injury. First one was 2 years ago. I was told the other day that you need to report your seizures to the DMV. I've never been told that by my doctor or NP, who has treated me for my seizure or injuries. I was only ever told not to drive for 6 months. So my first time I had a seizure, my driver's license was up to date the whole time. This time, my license expired during my seizure period. I'm on 1,500 milligrams of Keppra XR and 60 milligrams of Prozac. Both seizures were on days I had very minimal sleep, lots of physical and mental exercise, and had forgotten to take my medication. I started taking Keppra after my first seizure. First was a TC, second was unobserved with head injury, both complete loss of consciousness. My neurologist has communicated to me that we believe sleep deprivation and overexertion was the cause of both seizures. EEGs without hyperventilating show normal activity opposed to EEG when I was hyperventilating. What is the best advice you guys can give me for what to do next month rolls around? How should I go about renewing my license? Personally, I don't think you should. I think you should just
You
like
cannot renew your license in the state of Kansas.
you can't.
Nope. There is a question you have to answer at the DMV that asks you, have you had a seizure within the last 6 months? And if you answer yes, I'm sorry, we will not issue you a driver's license. Here is your state identification card. They did it to me in January. And in order to get your driver's license back, you have to get paperwork from the state medical board, and you have to take it to your neurologist and any doctor that is prescribing you medication and your eye doctor and get all of them to sign those forms saying that you are fit to drive. Then you have to go to the DMV with your own vehicle and take a driving test, and then you can get your driver's license back. And that's after you've been free for 6 months, of course, at least.
So this post could celebrate how long they've been seizure free, all the good data they've gotten in the meantime, for knowing what their triggers are, and take it from there
Yes,
on making arrangements,
absolutely. I would highly recommend
acquiring a
finding
support system.
a support system, and transportation means other than driving yourself because you cannot do so legally or safely at all. Do not risk it. It's not worth your life or the lives of anybody else. Yes, it's a major pain in the ass, but that inconvenience and pain in the ass is not worth taking someone's life.
You know
I'm
something?
having some good rants today.
Does anyone else have facial tingling? Hi, I'm 28-year-old female with generalized focal epilepsy. I have had tingling, light electric shock sensation on my left cheekbone for about 15 years now. It's not constant and it doesn't hurt, but it's pretty annoying. My doctor diagnosed with trigeminal neuralgia.
Trimengal. I think it's like
Trimental?
trimengal. I think it's trimengal neuralgia or something like that.
Trimental
Might be
neuralgia.
trimenial. I'm not sure. I'm not
Okay.
sure exactly how to pronounce it, but
I like your pronunciation better than mine. Um,
Trigonometry.
my doctor diagnosed me with trimenal neuralgia for this about 10 years ago. Last December, I noticed that this tingling electric shock sensation in my left cheekbone rapidly began spreading all over my entire face. This obviously concerned me, so I made a doctor's appointment to discuss it. Well, the night before that doctor's appointment, I ended up in the ER after experiencing my first grand mal. Since then, I was diagnosed with focal epilepsy, and I have seen a barrage of doctors. Yet every single doctor, even the neuros, have all dismissed my facial tingling as, in quote, unrelated. How? I refuse to believe it was just coincidence that my facial tingling suddenly spread from my face to my left cheekbone to my entire face right before I had a grand mal. I don't understand. Every single doctor has dismissed me and said I was not epilepsy related. Does anyone else experienced anything similar? If so, what kind of epilepsy do you have? There are only 3 comments. And one says, as a child, yes, mostly all of my seizures started as tingling feeling in my cheeks, usually right hand side. This eventually changed after puberty. You guys have anything similar to that? I don't have any facial tingling that I can remember personally. The ringing of the ears, they didn't say, but that I do get.
I have ringing and weird ear shit going on, but the only tingling I get's like in my arms and stuff. It's not in my face.
What's
Um,
the king got to say on this one, Angel? You ever get
Yeah,
any facial tingling here?
No, just I don't recall any facial except for tooth tooth problems. That's about it.
Well, apparently facial tingling is associated with epilepsy, a part of benign Rolandic epilepsy, BRE, a type of focal seizure that commonly affects children involving the face and tongue. It can also be a symptom of other focal seizures, like those originating in the frontal lobe or parietal lobe, or Jacksonian seizures. These ones are associated by, or they're characterized by tingling, numbness, or twitching in the face or mouth, and may include other symptoms like the drooling or difficulty speaking. But yeah, that is a type of epilepsy. And to say that it's and from seizures originating in the frontal or parietal, then those are pretty big brain lobes. It sounds like if one of the doctors, I think in the post, they said we're trying to convince them that it wasn't associated with the trigeminal neuralgia.
yeah,
And it looks like when it is associated with the neuralgia, then that right after their face tingles, it'll be painful. So if there's no severe facial pain, then maybe that does point in the direction of an aura for a seizure.
yeah, they were asking, yeah, if that had anything to do with their generalized focal epilepsy. Another comment here. One says, my tongue tingles every day. My hands and individual fingers will from time to time. It's all caused by my insular epilepsy, confirmed via SEEG. I just learned a new type of epilepsy.
I've heard of it. Don't really know anything about it though.
Got it. Insular epilepsy is a form of epilepsy originating from the insular cortex characterized by diverse seizures and complex clinical features, making diagnosis and treatment challenging. I mean, is there a certain type of seizure you have when you have insular seizures?
Sounds like all kinds
It
from that
says
description.
insular epilepsy arises from the insula, a region of the brain located deep within the lateral sulcus, um, often referred to as the fifth lobe of the brain. This area is involved in various functions, including sensory processing, autonomic control, and emotional regulation. Seizures originating from insula can present with a wide range of symptoms, making them difficult to distinguish from seizures arising from other regions of the brain.
Yeah, so overall difficult to diagnose. Throat constriction, painful sensations, those autonomic changes, like you said, heart rate and goosebumps. And that's why they're so difficult to diagnose because the cortex of the brain is such a deep part. That's why they have to get that SEEG to go under your skull and be able to pick up such a deep focal point.
Did you have that done?
Yeah.
Did it hurt? Like, was it bad to get done?
SEEG, I didn't take notes on, so I really don't remember.
You don't
I know,
remember?
yeah, I know there were no major complications from any of the year before RNS when they were doing all the diagnostic stuff. But it definitely got to be a blur, all the inpatient EEGs and then the SEG and yeah, waiting on insurance to get the results and say it's okay.
Be right back.
That was annoying.
I'm just getting ready to go into all of this testing. I was just like, oh my God, I hear about all these tests. I wonder what the hell they're gonna want me to do.
Well, here we
You
are
know,
5 years later and no regrets. So you can look at it like that.
I'm glad to hear all of the great stories. Honestly, it's made me feel a lot better about deciding to do all of this
And can't you see
because
this as like a time of transition for you? Like something kind of light at the end of the
it
tunnel?
scares the shit out of me. It's what it does.
I got one here. It says hormone therapy. I did not read it ahead of time, and it is quite long. So hold on to your seats. I was going to say ladies and gentlemen, but it's just two ladies here. Um, it says, and hormone therapy. I'm in perimenopause, 49, and so far I had no symptoms other than insomnia. But then with lamotrigine, I never slept well, and it's only getting worse in the past few years. I'm being extra careful and took advantage of some downtime in between contracts I'm consulting to do literally more than 100 tests. Yes, 81 were items in the blood work, and I didn't even know such number was possible. Everything all right, liver included. Lamotrigine plus benzos was worried. High cholesterol, but in 6 weeks with pitavastatin, I went from 300 to 200 with no muscle pains. Also, check my heart in every possible way: blood pressure, abdomen, ears, throat, and nose, bone density, lady parts, etc. The only thing I did was an EEG, which was ironic, but those never show anything. I'm averaging 1 to 2 tonics per year, so it's not perfect, but I do prefer to increase the dosage. The OBGYN gave me some cream with estradiol. These are
I think
ESTRAD.
it's like estrogen.
Yeah, it's like a synthetic estrogen, I think.
Okay. So I'm assuming it's something lady like. Um,
Yes.
okay, the OBG gave me the whatever the extra something is to use every night. They lower threshold for seizures and progesterone pills for 10 consecutive days each month, and those increase the threshold. So you see they're supposedly balancing each other out, but the 20 days where I don't take progesterone, I get afraid of seizing so much so that I agreed with the doctor to use half a dosage for a month and then titrate. She was okay with that. That was 2 months ago. I'm glad I started this because the scientific literature now says that you don't have to wait for full menopause because symptoms start earlier anyway. The ideally, you never allow your hormone levels to reach rock bottom to then make them rise. By the way, my seizures, TCs, were never correlated to periods, so not catamenial. I like to hear about experiences of ladies in the same position. What did HRT change for you, brain activity wise, and anything else? When did you start your HRT, and did it interfere with your meds? Did they give you any more energy? I'm still waiting on one. Lamotrigine makes me so tired.
I never had hormone replacement therapy, but that's probably just always going to be ill-advised for me because of the catamenial, and we know medication and hormonal fluctuations are definitely a trigger for me. But it was an option after the tubal ligations. They said that you could always go full hysterectomy and um, do the hormone replacement therapy, and that's pretty much what turn me off from it. Did you ever do any HRT before or after epilepsy? Okay. It looks like that's used by individuals with epilepsy, but it requires careful consideration due to potential side effects on seizure control. So the OB and the neurologist would definitely have to be on the same page with that, agreeing what to do with the patient's medication when they start and, how gradual. Maybe they would make it more gradual for an epileptic patient just to see how it affects their seizures. Start at a lower dose kind of thing.
There is one comment here. It says, I have no relevant experience, and I know you said your seizures are not catamenial, but there is catamenial universe. Might have a higher concentration of people to chime in. It's a smaller sub, but a lot of people there are navigating HRT and epilepsy.
Good recommendation.
Yeah, check out that catamenial universe. Got something that says, does anyone relate? I've had epilepsy since I was 10. It started with absent seizures, like a lot of them. I have then absolutely no memory of my life from the ages 10 to 13. I don't know if it's because of the epilepsy or because of something that happened to me at that time. Has this happened to anyone else? There are little bits and pieces of the story that I've lived that I don't remember. There are then a lot of stories that I do remember, though. So I don't know what I don't remember until someone asks me about it, and then I say I don't remember that. But otherwise, I have decent memory that I know of. I mean, that I can remember. Um, yeah, but there are some things that, like I said, there are some things where I'm sitting there like, what is it? What is it? I know it, and then I end up not being able to remember, and then end up forgetting what I'm talking about, so I can't describe it to people. Yeah, it's quite difficult.
I'll still look at it as a benefit because I have watched when we talked about Kill Bill the other night, I watched both of them like it was the first time. I didn't memorize any lines. I didn't like any of it down, but I know I've seen those movies 100 times. And same thing, Reasonable Doubt on Hulu. I'm watching the whole thing all over again, and like it's the first time. I don't know what's gonna happen yet, and I know I just watched it like last year. Oh
The
yeah,
good thing,
memory
the
loss
good
you
thing
can still
about
use to your benefit.
Amazon. Say that again.
I was saying we can all use the memory loss to our benefit, never having to like buy more stuff
Mm.
for entertainment.
I watch the same shows all the time. And I think the thing that bugs me the most about like when it comes to remembering my past is like when my daughter or my son or somebody's like, you remember, hey mom, you remember when blah 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 or whatever. And I'm just like, nope, sorry, I don't. Tell me all about it. Because I do not remember it at all. And it's like I feel awful because I don't remember, but I don't remember.
Um,
We're gonna hear a lot of that around the holidays.
Well, and sometimes it's like if they start talking about it, I'll like, oh, I do kind of remember something about that, but I don't remember the details. I just remember bits and pieces as they tell me. There's no way I could tell them like what happened. It's just familiar when they tell it to me.
Like you can't tell if that's your memory or if that's them telling the story again. Like maybe I just heard you say, tell this 6 months ago or last year, whenever the last gathering was.
Right. Did you tell me this last week?
Yeah, is this
I'm
how you met? Like something you tell me every time we talk?
How many times do you scroll back through your text messages to see if you already told somebody something?
I hate how you have to like you can't search. Like Control S is the or Control F is the shortcut for find on an email or like on a desktop, and I can't use something like that on the text messages on this stupid iPhone. I can't figure out how to search a keyword in this like millions of messages of like, do you already know? Yeah, that's annoying.
you guys got any memories? Well, Any memories that you don't remember is basically what it's asking. I can relate to not remembering things around the age of anything before 20 can get a little fuzzy. But I believe in between 20 and now, kind of more there than my earlier childhood.
But that's impressive because it
You
sounds like
really
your brain
cracked me up.
adapted.
Say that again.
I was saying that's
As-
amazing because it sounds like your brain adapted. Like your memory got better.
Um, it's just like childhood memories. Somebody would have to remind me, and then I might be like, "Oh yeah." But other than that, there's a lot of stuff I do not remember enough to just bring it up and be like, "Oh, talk about a certain story or anything." But yeah, it's there if someone tries to get a memory out of me, and I could probably, yeah.
That's
But
a
there
big
also
deal.
is, there's a lot of times lately my mother's been asking me stuff, do I remember? And then I was gonna tell her, I think you're tripping, but I could be tripping, so I don't know what to say. Sometimes I'm like, I think I know if I've been through this, but I don't want to argue with you because you might know better. But yeah, there's some things that my mother was telling me that I wanted to say. I think you're tripping. I think you got some times missed up.
You can totally test family members by asking about like, okay, if you have like a scar that's pretty easily recognizable and you've heard a million times, you know how they told you got it once upon a time. But those same family members change their own stories, whether or not they realize it. So you could kind of throw that out there as a test question. You know what her answer would be to this question. Ask it again. See if her answer changes, then that's a better indicator of how often they might be coming up with things that didn't really happen that way. But we're always going to be taken for less reliable when it comes to looking back.
I had a whole
Why?
wardrobe
Okay,
at my
go ahead.
mom's house.
Did it still fit?
Yeah. Um, yeah, I forgot all the clothes that I left here because I got on the train and came down here and then end up getting back in an Uber and the car didn't have enough space for me and my children's clothes, so I left a whole lot of clothes. And now that I'm back here, a lot of these clothes I've been looking for. I did not know they were here. I got like two huge duffel bags of clothes and clean stuff that I just forgot was here. A pair of
Oh, your
shoes that I've been
signature
looking
outfit's
for.
coming back to you.
Yeah, it's like these Jordans, like I didn't know where these were. I didn't know they were even down here. I gave up on them. I thought I left them at someone's house. I don't know how I lose shoes.
But now they're wiped down and brand new.
And I wiped down, but they're new. I mean, they feel good on the feet, so I guess that's all that matters. But yeah, I'm finding stuff. You guys ever leave stuff at someone's house and then didn't remember until you found it?
I'd have to go to someone's house first.
Yeah, it was that way with mother keeping my keepsakes, but for the most part, she got rid of all the teenage stuff after the, fell out of touch thing. She still has teeth though, baby teeth.
My mom still has a bunch of crap in her basement, of course, from, growing up and this and that and whatever. That was mine. But I probably don't need any of it at this point because I don't even know what's in there and haven't looked at any of it in about, a couple decades at least.
More likely arts and crafts than like extra socks.
She's got like my grade card from kindergarten.
Your attendance award or something.
I'm not kidding. She will. Every award I ever got. She has a file cabinet as tall as me.
That is love. There's something she
Exactly
remembers
what I was
good
about to
about
say. That's
those.
love right there.
There's something that
She's
she likes about those that made her keep them.
and she's a very much organized person that is worked in compliance.
Is she a hoarder?
Oh no, not at all. But by God, if there's papers on her table, her house is destroyed, in her opinion.
Ever go to sleep with dishes in the sink, I bet.
No, as soon as you're done eating dinner, you get up and you do the dishes, clean the
Mm.
whole kitchen, wipe down all the counters, you
The
change all the sheets,
the
do all
door
the
frames
laundry,
and the fans every
dust,
time.
you dust, vacuum, everything every weekend, wash all the bathrooms every Saturday and Sunday.
Don't you dare call the floors clean unless you went over them 3 times.
I'll bet they mop twice a week. I bet you she mows probably twice a week.
And then during COVID, you had to do all that with the Clorox.
I don't know. I stayed home.
Yeah, and it was just like all different chemicals, more germ killing and more bleach stuff.
Oh no, she's on the no chemical, some really expensive. All you got to use is water, some special. I don't know.
Yeah, I
It's
don't know.
magic.
Of course. It's probably some kind of glorified dish soap.
It's magic.
Were you guys one of those people to go on trips and vacations during the pandemic?
Once on quarantine,
I did
because
not.
Florida left stuff open.
Yeah, someone got my grandma sick. I think it was another family member. Well, I know it was another family member, but recently he said that someone had got him sick because they had just went on a vacation. So then I was like, yeah, my
Well,
grandma
let's put it
passed.
this way. Let's put it this way. I'm so sorry.
It's all right.
Um, I stayed home and I never got COVID, and the family members that go get on the planes and go jumping all over the country to visit this grandkid and this grandkid and this child and that child. She had COVID 7 times.
Um,
Talk about careless. AJ says, yes, I did. During that time, I left the house most often. So what was the result on catching COVID? You feel like you got sick more often because you went out more often?
for some reason, I stayed in way more often than I've ever done in my life. Um, I had just got into a relationship like early in the beginning, and then I stayed in the house a lot after that, and had way more on the list than I'd want to admit. Like I was having like six, maybe eight, 6 to 8 a year, which is really high for me. Um, yeah, it was closer to 8, but sometimes it was 6. And yeah, my mom, I used to tell my mom and my dad, I used to be like, it's her. It's not COVID, it's her.
So you
Uh,
did actually quarantine with the new girl.
yeah,
Oh, wow.
I moved in with her and her kid. And yeah, they both got it, I believe. And I quarantined with them.
AJ is saying, nope. In my case, I did get COVID and treated with vitamin C. So even though AJ went out more often during that time, you get COVID and treated with vitamin C. In that case, and that you didn't catch it like 7 different times, different strains or whatever.
I got one here, you guys. For some reason, I want some chocolate. Um, yeah, I don't know where I get these urges from.
Please take your medication as prescribed or whatever works for you. We're not doctors.